Welcome to the presentation on cancer. In this presentation, you will learn about the disorder, such as symptoms or behaviors, possible side effects that may occur with chemotherapy and/or radiation. Also, we will talk about the educational implications of students with cancer and some instructional strategies and classroom accommodations that may be helpful in dealing with these students. Cancer is not a single disease, but a large, heterogeneous group of diseases that share certain features. Some of the features may be abnormal tissue growth, division and proliferation of cells, the spread of cells to other parts of the body, or it may have the phenomenon of cells invading and destroying other normal organs and tissues. Cancer in children is different from cancer in adults. Childhood cancers are made up of two main groups, that of solid tumors and the leukemias. Malignant tumors are growths that can occur in any part of the body. They are non-communicable, meaning that they cannot be spread from one person to another. The signs, symptoms, and the response to treatment in each patient depends on the location and the type of tumor. Leukemia in children is a malignant disease of the blood-making system of the body. Children with leukemia have an increased production of immature, abnormal, or poorly developed white blood cells. When this happens, it inhibits the production of normal blood cells in the bone marrow. The two most common forms of leukemia are acute lymphoid leukemia, also known as ALL, and acute non-lymphoid leukemia, known as ANLL. Both of these types of leukemia have similar characteristics, that of too many immature white blood cells and systemic problems, which may manifest themselves by organ failure, problems with the central nervous system, thin and weakening bones, or severe bone and joint pain. It is unknown why cancer occurs. What is known is that environmental factors, such as exposure to radiation or to certain chemicals, viruses, or defects in the body's chemistry, may contribute to the disease. Several disorders, such as Down syndrome, have been known to be associated with an increased incidence of leukemia. Leukemia accounts for approximately 30% of all pediatric cancers. With acute non-lymphoid leukemia being the most common type, this occurs in about 80% of the cases. Leukemia is found more commonly in boys, regardless of what race they are. The incidence of leukemia peaks between the ages of 2 and 6, and it is the second leading cause of death in children between the ages of 2 and 15. When treating any type of cancer, the ultimate goal is to remove or destroy the abnormal cells. This is done by surgery, radiation, chemotherapy, or sometimes a combination of these methods. Supportive therapy plays a major role in protecting patients. This therapy allows them to survive the critical period needed for the benefits of chemotherapy to take effect. It may include antibiotics, germ-free isolation, and transfusions of white blood cells and platelets. The following is a summary of symptoms of cancer: easy bruising, bleeding without clotting, high fever, continual weakness, chronic fatigue, pain in bones and joints, recurrent infections. Possible side effects that may occur with chemotherapy and/or radiation treatment are hair loss, nausea and/or vomiting, weight changes, discomfort, which may contribute to anxiety and the inability to concentrate. How does cancer affect the student's education? The child will most often be able to participate in a regular school program. However, it is very important that the school staff is knowledgeable about the student's illness. Before the student returns to school, the teacher should obtain the following information: what the specific type of cancer is and how it is being treated. Also, we should find out the treatment the student is taking, when it is administered, and what the potential side effects are, and how those side effects might affect the student's appearance or behavior. The teacher should also get the following information before a student returns to school: an approximate schedule of upcoming treatment, procedures, or tests that might result in the student being absent from school. Also, a list of any limitations on the student's activities. It is best to get periodic updates. Before the student returns to school, the teacher should find out what the student knows about the illness, and also for younger students what the family would like classmates and school staff members to know. Before the student returns to school, the teacher should also get the following information for adolescents: whether the student wishes to talk directly with teachers about any of the above points. It is important that the teacher meet with the student to address concerns that the student may have, such as, will others stare at me because I look funny? Will I still be included or dropped out of my group? Are teachers upset with me because I missed so much school? Will I not know as much as other kids? Remember to respect a student's choice of not speaking with teachers or peers about how they are doing or how they are feeling. Although overprotectiveness is a frequent emotional response of school staff, children do need to know limits, and they need to be expected to follow the rules. Many studies have shown the importance of having the student return to a normal daily routine as soon and as much as possible. The following is a list of instructional strategies and classroom accommodations for children with cancer. They would benefit from curriculum modifications, such as extra time for assignments, doing every other problem, no time limits, or alternative ways to test and to get information. They would also benefit from a buddy system for notes and from teacher outlines. Absences from school may require repeated instruction or modified requirements in the classroom. Tutorial services and homebound instruction might be necessary.